Hi, everybody. This is Jessica DaMassa with WTF Health. What's the future health? I am talking to the who's who of health technology and healthcare innovation. And in this special series, sponsored by Bayer G4A, we are talking to startups and scaling companies that are identified as agents of change. So please welcome from Sweetch, the CEO and co-founder, Yossi Bahagon. Nice to see you there. You are in Jerusalem, is that right?
Yeah, indeed. Nice and good evening.
Good evening. Well, it is a pleasure to talk to you. One of the things that is really interesting to me about Sweetch is that you are a company that is devoted to outsmarting chronic disease. And the way that you do this is by using just-in-time adaptive interventions. So this is so much more different than what I expected it to be. Explain what that is. What's a just-in-time adaptive intervention? What does that look like to a patient?
So what Sweetch is doing, we are targeting to increase the likelihood of a patient doing what he or she needs to do. How do we do that? We pull data from the patient's smartphone and other connected devices, and without asking the patient any questions, we learn about the patient's life habits, or the way we like to call it, the patient's life print. Because each and every one of us has a certain way of living his or her life. So we turn the data that our phone and connected devices collect into actionable, individualized recommendations. What does it mean in real life? Instead of telling you, hey, Jessica, you need to walk 10,000 steps a day, the messages that you will get from Sweetch would look like the following. Hey, Jessica, good morning. You have 45 minutes before your next meeting. It's raining outside, so maybe take an umbrella and go pick up an Americano from the nearest Starbucks at the 36 in Madison. It's only 9 minutes away. So we turn the generalized recommendations, whether they are activity focused or weight management focused or medication focused or patient reported outcome focused, we turn them into a highly personalized recommendation, but that's half of the magic.
Okay, what's the other half?
So this is the just-in-time half of the magic. The second half is the adaptive feature. So after this recommendation is sent to you, the system learns from your behavior what works and what doesn't work. So the system is able to predict which recommendation you will most probably act upon and which you will ignore. And those that you will most probably ignore, the system will not send to you. So the idea is just like precision medicine, which tailors the treatment based on the individual characteristics, in Sweetch, we target precision engagement. So to tailor the interaction with the patient to your personal life habits and personal behavior, and dynamically and continuously optimize it based on how you really live your life.
This sounds so cool. What disease areas have you focused on so far with this technology?
So we started our journey with diabetes prevention and diabetes management. Today, we are across metabolic syndrome diseases, so including cardiovascular diseases, autoimmune diseases, and oncology diseases, with the same principle. How do you tailor the interaction with a patient in a way that will increase the likelihood of the patient adhering to what he or she needs to do?
And so tell me this. So in the example that you gave, you're talking about creating this very personalized message that really has nothing to do with my condition. It has nothing to do with my disease, but it's helping me manage it by putting it in the context of my life. What kind of data are you able to gather either from the application on the phone or from the wearable to make those predictions? So, I mean, I heard you say something about location. It obviously knows my location. It knows what time it is. Like what other factors are you including in your algorithm when it comes up with those personalized recommendations?
So we are using the built-in sensors within the smartphone and again, other connected devices like connected blood glucose monitoring, connected scale, connected blood pressure monitoring in order to reveal in real time what is the context that you are in. So you mentioned location, you mentioned activity, so accelerometer. We measure the ambient light around you, so to know when you are probably going to sleep. We measure to which Wi-Fi are you connected, because this is another anchor that tells us whether you are home or at work. We correlate this data with other data that to know that what is the, for example, the environment that you are in. Did you enter now a restaurant and then maybe it's the time to remind you to measure your glucose levels before you go in? Did you enter now a grocery store? So it's the time to remind you to pick up more stuff that contains fiber. Did you go now into a clinic? Did you go into a hospital? Did you go into a school? So all these parameters, which we know through analyzing the raw data, we turn them into insights about you.
I love it. And I love that it's done ambiently. So tell me about the patients that you have on the platform. Can you give us a sense of like the number of people who are using it and some of the outcomes that you've been able to achieve clinically?
So it's important to mention that Sweetch is not a direct-to-consumer app. Sweetch is a prescribed app that is recommended to the patient, but by what we call a trusted authority, either a physician, a medical team member, patient support program. And this is very important because we position Sweetch not just, okay, it's a nice wellness app, but as part of the clinical intervention and the patient journey. So when the physician introduces Sweetch to the patient, it's important for him or her to say, listen, this is part of your treatment. This will help you manage your disease better. And also it will help the physician manage and better personalize the treatment that the patient gets, because some of the insights that the platform collects are presented in a dedicated dashboard to the physician or the patient support program. We are used today by thousands of patients globally, including in Australia, Canada, US, Latin America, Germany. And we are now moving from being an R&D focused company that launched with, as I said, globally with several thousands of patients. And now we are going into the hockey stick curve where we are growing from thousands to tens of thousands, because the fact we are based on data science and not human intervention enables us to scale to the millions and to the tens of millions in a very cost-efficient way.
That is an excellent point, because I think that's one of the hallmarks of a lot of the digital health solutions in this space, is that they often have a human health coach component to them, which does make it difficult to scale up in terms of helping keep people on track and keeping patients engaged in the program. And you basically eradicated that by using technology in a very clever way. So I'm curious to know, on the other side of this, this is obviously, as you gain more users, you gain more insights into what we as people do and how we behave. So tell us a little bit about the data in terms of what's to come from aggregating all of it. What's the future there as far as your hopes for what you can learn about the way that people interact with chronic conditions and how that can be useful to the healthcare industry?
So that's really amazing and deep question. Before answering that specifically, I want to mention that Sweetch is clinically validated, meaning it's not just, okay, we see the data on our side and we think it's great. Johns Hopkins did a clinical trial using Sweetch in patients with prediabetes, and without any human intervention, the system achieved 86% patient engagement and clinically and statistically significant outcomes like A1C reduction, increase in physical activity, weight loss, and about 23% of the patients actually reversed their diabetic state. Wow. And again, without any human intervention. Based on this study, the NIH just approved Hopkins and Sweetch a multi-million-dollar grant to compare Sweetch fully automated intervention to the gold standard in diabetes prevention, which is a CDC-approved intervention. As you nailed, one of the assets in our solution is the data. So if you look at the world of healthcare data, we have today data in electronic health records. We have today data that is related to genomics, omics, microbiome. We have data that is related to a physiological biometric like heart rate, blood pressure, and so on. And the missing part in this data equation is our behavior. So how, for example, our sleep, our individual sleep, affect our glucose levels? How, for example, our activity affect not general population level, but individual level, our cardiovascular risk. And this is exactly the deep asset of what Sweetch brings to the table. We bring in individualized behavioral data that will influence both disease prevention and disease management on a highly individualized way.
Yossi, this is so exciting. Congratulations on everything that you've achieved so far. What's next for the company? If you can give us a sense of where you're headed next. You just mentioned that big NIH grant. Congratulations on that. Last words on where Sweetch is headed as a company.
So the passion and the vision of where we are coming is we want to leave the world a better place after we are launching. So we believe we have a solution that can influence population health at the masses. So again, not 500,000 people, but 50 million people. In the US alone, there are 120 million people with metabolic syndrome. This magnitude of epidemic can only be treated or you can influence it only with tools that can touch the masses, meaning based on data and based on technology. So what we want to do, we want to influence the lives of tens of millions of people and to do it in different chronic conditions like we just starting. So we are now at the beginning of our growth journey.
Well, this is very exciting. Just-in-time adaptive interventions. I love it. We might as well call it auto-magically. I think that's a nicer term.
Yeah,
much easier for me to say.
Okay.
Yossi, thank you so much. The company is Sweetch. We were just speaking with Yossi Bahagon. He is the CEO and co-founder of the company and one of the companies that Bayer has identified as an agent of change this year. I'm Jessica DaMassa. Thank you so much for joining us. Please check out WTF.health. For more interviews with thought leaders who are shaping the future of health. We'll talk to you guys soon. Thank you so much.
Thank you, Jessica.